Again, and welcome back. DangTeach at CCSD. We're going to conclude our discussion on common drugs and their uses today. If this is your first time with us, welcome to the community. And if you're joining us again, welcome back, welcome back, welcome back. All right, the drugs for today, we're going to talk about GI urinary agents, hematological agents, hormones, immune agents, and lastly, musculoskeletal products. GI and urinary tract agents. So from time to time, we'll have problems urinary or intestinal, and a lot of these agents are going to be available over the counter. Enzyme replacement. So for fats and proteins and carbs need to be broken down with their appropriate enzyme. So the enzyme that breaks down proteins are pepsins. If you break down fat, then your lipase. And then there's a bunch of other ones for carbs like amylase. So if you are deficient, your pancreas is not producing any of these, then you may have some problems. So for example, lipase from the pancreas, if you don't have any, then you're not going to digest the fats that's in your diet, and all the fats will just run right through you, and you'll have fatty diarrhea. So steatorrhea is fatty diarrhea. And you can tell steatorrhea is if your stool is floating. If it's floating on the surface of the water, then definitely that is steatorrhea. So if you don't have the enzyme that breaks down fat coming from the pancreas, then you can actually supplement it. Just take a little capsule and it'll have the active enzyme inside. So with every meal, take a capsule and you should be fine. We'll provide the enzyme for you externally. Antiemetic, so vomiting, so drugs against vomiting, nausea and vomiting. So we have two vomit reflexes. We have a chemo one in the brain, so certain chemicals that we're exposed to will trigger the vomit reflex. And we also have stretch receptors within the pharynx that will give us the vomit reflex. AntiDiarrheals. So many reasons for diarrhea. So there's many ways to treat it as well. The most dangerous thing is the water and electrolyte loss, since that is the last thing that your body will be absorbing in the colon. So the large intestines is where water and electrolytes is absorbed. And to treat it, we can give you things that slow down the intestines, so decrease motility. So loperamide and atropine. So they usually give atropine to infants. Loperamide you can get over the counter. So that's going to slow you down. Next, you can get things like Pepto-Bismol. They're going to decrease secretions, so there's going to be less watery substance within your stools. And if you do have an infection, they'll treat it with antibiotics. Nowadays, they also have medical foods to help fight diarrhea, and medical foods with probiotics or food that is prebiotics. Prebiotics are food for the microbes. Antacid and anti-ulcer medication. So when you have excessive acid production, that can erode away the lining of the stomach, causing an ulcer. So we'll give antacids. Usually it's the base form. So magnesium hydroxide normally gives you diarrhea. Remember, mag makes you sag. And then aluminum hydroxide normally causes constipation. So to counter that, we might give you an antacid that has both magnesium and aluminum salts. Other acid meds are the H2 antagonists. So we have histamine receptors, different types of histamine receptors in the body. We have them in the skin, in the lungs, and also in the GI tract. So H2 specifically is in the GI tract, and we'll target it to prevent acid release. Protein pump inhibitors, so the cells that directly produce acid, we can inhibit their action. Things like Protonix, rabeprazole. Laxatives and stool softeners. So they're similar in that they allow you to lactate, but they work in different ways. So bulk forming agents will draw in just water, whereas stool softeners will draw in both water and fats, hopefully allowing you to be more regular. But the best thing is probably just fiber. Just eat a diet with adequate amounts of fiber, and you should be pretty regular. Lastly, to promote lactation, we have electrolyte solution as an enema. Osmotics the same. So electrolytes and osmotics, that's going to control the movement of water. So if you put something really salty in the digestive tract, hopefully it draws in water and loosen up the stools. Oil, that's just going to lubricate any stool that's there. Hematological agents. So prothrombin is the inactive form of thrombin. So it gets activated by exposure to proteins that are usually on the outside of the veins and arteries. So if there's a cut and you're exposed to stuff that's usually on the outside, then that will promote a clot. And it acts on platelets. So fibrinogen is the non-sticky form of platelets and turns it into fibrin. It's insoluble, sticky, and they'll help create that clot. For hemophilics, they have a problem with one of the 13 clotting factors. So it actually takes 13 enzymatic steps to form a clot, because we really want to know, is this what you want? Do you really want a clot to form? Because once one forms, can't really go back from it. So for the different types of hemophilia, they're just missing different clotting factors. Vitamin K is the antidote to warfarin, Coumadin, which is the blood thinner. Hematopoetics, so drugs that stimulate the production of blood cell growth. So we have red blood cells and white blood cells, drugs that we can use to stimulate. So for red blood cells, we have Epogen, erythropoietin. And for white blood cells, you have Neupogen, which is filagastrin. That's a generic name. So some athletes will abuse Epogen to increase their red blood cell count for prolonged stamina. Sickle cell. So sickle cell is a misshapen red blood cell, and sometimes they get too large to fit into or through the capillaries. However, if you're a carrier for the sickle cell trait, you are actually immune to malaria. So there is a evolution or survival basis for having the sickle cell trait. B12 is required for healthy synthesis of red blood cells. And of course, if you have cancer or any other disease taking energy away from blood formation, that will cause anemia. Iron in the center of every hemoglobin molecule within a red blood cell is an iron. So you might supplement with iron as well. Hemostatic, something to stop blood. So you can take something internally like vitamin K, or you can take a topical product like quick clot. So quick clot is derived from shrimp, and it really causes an aggressive clot to form to prevent or stop the bleeding. Hormones and modify. So the good thing about our bodies is it can't tell the difference between a hormone that it makes itself or a hormone that it got from the outside. So that way we can supplement hormones if you need to. So here are just some glands and their purposes. So pituitary, it is the master gland and it regulates the other glands. Thyroid, calcitonin, and parathyroid hormone will help balance blood calcium. So calcitonin makes strong bones. Parathyroid hormone is going to dissolve the calcium from bones and put it in the blood. So calcium is important in the blood. It is one of those clotting factors and important for muscle contraction. Thymus, part of your immune system. It will make immune cells. Pancreas with insulin. That's its hormone function, is to produce insulin. The digestive enzyme, then that's its exocrine function. Insulin is its endocrine function. You have your adrenals for metabolism and energy. You have corticosteroids and glucosteroids that will work on your sugar metabolism. And then your gonads for sexual development. So we can introduce any of these hormones in your body and they would work. Immunity. So immunobiologic agents and vaccines. So passive immunity is if you get the antibodies from an outside source. So for example, breast milk. The child is not producing antibodies against pathogens in its environment, but the mother sharing the same environment is, and will give those antibodies to the child through breast milk. So the child will be also protected. If you stop breastfeeding, then you will lose that protection. We've also isolated the antibodies. So they're just globular-shaped antibodies, and we make it intravenous form. An example would be Hep B. So for hepatitis B, the child is exposed through the birth canal of a hepatitis B positive mother. We can't start the vaccine because the vaccine won't work on time, so we'll give them the immunoglobulins for it. Vaccines are going to be actively producing the antibody. So after your first exposure, your body will remember and will be able to produce the antibodies very rapidly after the second exposure. So we'll inject you with the microbe, the virus or the bacteria, a weakened form or only parts of it. Just part of the cell wall is enough for our body to, or enough to cause an immune response. So we have a lot of vaccines for our children, and some are kind of questioning the toxic effects of having these many doses so soon. That might have led to the lower vaccination rates currently. Musculoskeletal agents. So I have three types of muscles: cardiac muscle, smooth muscle, and skeletal muscle. So skeletal muscles are very similar to cardiac muscle in that they are striated. The only difference is cardiac muscle has the intercalated discs. So attaching muscles to the skeleton are the tendons. And then we also have agents for the bone as well. We have 206 bones approximately. Some people have more. We have your axial skeleton here in red and your appendicular skeleton in blue. So your arms and legs are your appendages. So bone are held together with ligaments. So connecting muscle to bone are tendons, connecting bone to bone are ligaments. And at the end of the bone, there's cartilage. Muscle spasms can be very painful, kind of like a cramp. Sometimes you'll get electrolyte imbalance, and you'll get the spasms and cramps. You can use a muscle relaxant like Valium, a benzodiazepine, or a sedative like Soma, crisaprotol. Flexerol decreases muscle tone. So this is good for when you have a neck injury. So without you knowing it, the muscles of your neck are working really hard. The ones in the front are pulling your head down. The ones in the back are pulling your head back, and they're always working. You don't notice anything until you damage one of them. So if you damage the front side, then your head's always tilted up. It really hurts to put your head down. So what we'll do is we'll give you a muscle relaxant to relax this muscle so it doesn't pull on the damaged muscle in the front. Three types of arthritis we'll discuss: rheumatoid, gout, and osteoarthritis. Rheumatoid arthritis is an autoimmune disease, so it's your own body attacking the cells in your joints. So we can treat it with gold compounds or methotrexate. So methotrexate is a chemo agent, and hopefully that suppresses the immune system. Next is gout, which is metabolic arthritis. So the nitrogen waste compounds in our body is usually in the form of urea. So urea is highly water soluble. It's what turns our urine a little bit yellow. However, for some patients who can't really process nitrogen waste properly, urea, they won't have urea, but they'll have uric acid, which is not as water soluble. And then the crystals usually form in the large toe. Very painful. Lastly, osteoarthritis. Osteoarthritis is just physical damage to the joints. So repeated function, repeated damage can lead to osteoarthritis. But if you let the joints rest, they'll slowly heal. Osteoporosis is when your bones become porous, loss of calcium. So we'll give you agents to increase the bone density. So we can also give you calcitonin, as mentioned when we talked about the thyroid. Right, that concludes our lecture on common drugs and their usage. So very good job, everybody. You made it to the end of this lecture. Again, I'd like to thank you for joining me, and those of you who are new, check out the other videos for pharmacy. There's also math videos and SIG code videos. Coming soon will be medical terminology. Again, thank you guys. You guys have a good one.